Okay.
Okay, great. So, good morning, everybody. This is an approach DSS waiver hearing today. Representative Walker, do you have anything?
No, thank you very much. And I just want to say good morning to everybody and not happy holidays at the end. Thank you.
I don't know if Senator Minor's on yet. He said that he had some constituent business and was in and out of cell service. Hopefully with the broadband expansion, the northwestern corner will actually get some cell service. Is Representative France on? No. Representative Abercrombie.
Yes, good morning, everyone, and thank you for being here.
Senator Moore.
Good morning, everyone. Take care.
Oh, there's Representative France. Go ahead, Representative France.
Hey, good morning. Thank you. Looking forward to the discussion. Thanks for the time.
And who are the ranking members? Kathy Abercrombie.
Representative Case and Senator Berthel. I know Representative Case is on.
Representative Case, do you have anything for?
Good morning.
Good morning.
Let's get going.
Senator Berthel. All righty then. Commissioner, we do have if you could just clarify a little bit today, the differences between a SPA and a hearing relative to today. That would be helpful also. So I believe you're first up, Commissioner Gifford.
Thank you, Senator Austin, and good morning to you, to Senator Moore, Berthel, and Minor, and Representative Abercrombie, Walker, Case, and France, and other distinguished members of the Human Services and Appropriations Committees. As you know, I'm Deidre Gifford, the Commissioner of the Department of Social Services. I'm joined by colleagues Jennifer Cavallero from DSS, also Don Lambert and Bill Halsey to answer any questions that you might have on the technical aspects of the waiver. And then also Aaron Levitt-Smith from DMIS is here to answer questions. You are probably aware that Commissioner Navarrete was unable to join this morning. So we are here today to seek your support to renew the department's mental health waiver. The effective date of the waiver is April 1st of 2022. We'd like to begin just by emphasizing the purpose of this waiver. It's for individuals and their family members and identified representatives in ensuring access to high quality and cost-effective services. As you know, since April of 2009, the Department of Mental Health and Addiction Services has operated the waiver, with DSS having administrative oversight. This mental health waiver provides services to adults with serious mental illness. The services can be provided either in the participant's home or in a community setting. The service delivery is designed to emphasize participants' strengths and assets, and also integration into the community. The mental health waiver uses a recovery orientation and provides critical supports that currently allows 579 individuals to live in the community by providing a diverse array of services. Without these services, and this is the point of this waiver and our other long-term care waivers as well, participants may be required placement in an institutional setting to receive the services absent this type of a waiver. The average total Medicaid cost per participant in the waiver is $52,000 per year. $27,000 of that cost is in a waiver cost, and $25,000 is in their non-waiver Medicaid costs, and that's total computable per participant. We did post a notice of intent for renewal of this waiver as required for public review and comment in the Connecticut Law Journal as well as posting it on the DSS and DEMIS websites beginning October 26 for a period of 30 days. We have received no comments in response to the notice of intent for renewal. There are not a lot of changes in this waiver renewal. For the most significant change is the proposed addition of 2 services. One is interpreter services and the other is in-home mental health counseling. Both of these services have been successfully utilized in our other Connecticut waivers and would offer additional options to those served by the mental health waiver. Interpreter services will allow monolingual participants to have interpreter services more reliably available during assessments and meetings. And the mental health counseling service will allow participants the choice of having counseling in their home environment rather than an office or clinical setting, if that's more appropriate. The amendment also makes some technical changes by administratively removing the group recovery assistant and group community support programs. Although it's important to know these services are not being removed from the waiver, we're simply changing how they are coded. The group component can now be authorized and billed using a modifier to another waiver program. So that's just an administrative technical change. In addition to adding the services, we're proposing to increase the annual limit for assistive technology services, increased from $1,000 to $2,000 per participant. This is requested because many of the providers for the waiver have told us that participants are not able to get the technology they need under the $1,000 limit. One of our providers gave us detailed information, which allowed us to make this estimate. We anticipate that there are about 100 current participants that have expressed an interest in obtaining updated or new technology, which cannot be done with the current $1,000 limit. We're also updating the waiver capacity to reflect the current program capacity. The maximum allowable clients for year 1 will be set at 752, with small increases each year to a maximum of 896 individuals in year 5 of the waiver. In addition, we're modifying the reserve capacity for participants that are transitioning from the Money Follows the Person program onto the onto the mental health waiver. It's adjusted to 45 slots to more accurately reflect the historical usage. We currently have 60 reserve slots. Slots are reserved, just to explain what that means. The slots are reserved within that waiver capacity of 896. Slots are reserved to ensure continuity of services for people who migrate from the Money Follows the Person program after 365 days onto the mental health waiver. And again, the number of slots that we're reserving is being changed based on the current number of people receiving services in MFP and anticipated changes in the trend. Technical updates in the waiver include updating performance measures as recommended by CMS, identifying services that utilize electronic visit verification, and indicating certain services that are billed directly through the state's Medicaid claims payment system rather than through a fiscal intermediary. With respect to your question, Senator Austin, about the difference between a state plan amendment and a waiver authority, would you like me to address that now or during the Q&A?
Thank you, Commissioner. Is there anybody else from your office that has anything to say right now?
No, I think we just respectfully request that committee approve our request to renew the waiver, and we're happy to answer any additional questions that you might have.
Do you have a waiting list at all for this waiver or any of the others?
Yes, we, I believe the number on the waiting list for this waiver is 36. Is that correct, Erin?
It is 32.
32.
Okay, so I'm Thank you for that. I might have a couple of other questions relative to that, but we'll have Erin Levitt-Smith give her presentation before we go into in-depth questions. Erin?
I'm
And
here
your
to answer.
Commissioner, and as Commissioner Gifford said, Commissioner Navarrete couldn't make it today due to personal business, I believe.
That is correct. I don't have a presentation. I'm here to answer questions on the programmatic side. We conferred with DSS on the testimony that Commissioner Gifford just gave.
Okay, great. Thank you. So if you could just raise your hands if you have a question. My first question was relative to the number of people that are on the waiting list. Does that include all components of the waiting list, Commissioner Gifford?
I'm here to answer questions.
I'm not sure I totally understand your question, but that is the entire waiting list.
Okay,
Correct,
great.
Erin, for the mental health waiver?
That is correct.
Yeah.
Thank you. Thank you, Commissioner. Representative Walker.
Thank you, Madam Chair, and thank you, Commissioner, for your presentation. I want to ask just a couple of questions, and I want to piggyback off of what my colleague was questioning about. There are other MFP waivers that we have. Is that correct?
Money Follows the Person is a program, a standalone program. People receive the benefits of Money Follows the Person, those transition services that help them transition from an institution into a community setting. They receive those transition services, and then they receive, under the MFP scheme or approvals that we have from CMS, they receive services, home services, for 365 days. At the conclusion of that 365 days under MFP, we need to transition them to another program to support their home and community-based services. And you are correct, there are a number of other waiver services that they can transition to. They don't all transition to the mental health waiver because they're not all appropriate for the mental health waiver. They would transition to one of our other home and community-based services programs. There are a number of places where a person who's in MFP can transition to get their home care services after 365 days.
Okay, so because the reason why I asked that, and my follow-up on that, is because people have been writing to us, or at least some of us, about that they're on a waiting list. And when I drill down into it, it's not the mental health waiver, but it may be housing or something else. So that means that we must have waiting lists in other areas for MFP. What other areas do we have waiting lists for, and are we looking to address those in some way, shape, or fashion?
So we do have waiting lists in some of our other waiver programs, and we would be happy to send you, sort of a comprehensive list of all of the waiver programs and where there are waiting lists. But they're not all related to MFP, Representative Walker. If you're talking about the challenges with transitioning people, let me just make sure I understand your question so we answer it appropriately. Are you talking about the challenges of people leaving an institution to get into home care through Money Follows the Person? Okay. Yeah. So Dawn is here, and she can address what we're seeing there, as has been the case and is the case around the country. One of the primary challenges we face is finding suitable and affordable housing for people leaving an institution. And we work very hard on that, but that continues to be a challenge. Dawn, do you want to talk about the details on the barriers that we're seeing in MFP?
Sure. So thank you.
Good
morning. Good morning. Thank you, Commissioner. We did, there are not actually what you would call a waiting list in the waiver sense for Money Follows the Person, but there definitely are some people waiting. And I think that you all perhaps have received correspondence from members who are frustrated that they can't move out of the nursing home as quickly as they might like to. We did provide for you the last quarterly update, and you should have received that as an attachment. We do study the challenges, and every single challenge that anybody experiences is recorded on a regular basis so that we can put in place interventions to address it. So that's all quantified, page 7 of the report that you received. You'll be able to take a look at those challenges. Now, what's happened as a result of COVID and what's become, all of these things have always been challenges. The reason money follows the person here is because we know there are challenges. It isn't as simple sometimes to get out of a nursing home as easy as it is to get in. There are more barriers, and they're varied. Right now, the 2 major barriers are housing, and Representative Walker, I think you mentioned that. Now that's been further complicated because of COVID-19, right? We stopped the evictions. The turnover of housing was very different during COVID-19. Affordable housing, not just housing, but affordable housing was very, very different. And it absolutely has created some additional delays for people who are moving out, who don't have housing, for whom we have to find housing. The additional challenge right now is direct workforce. We need to find, and we don't just move people out, we move people out and we coordinate all those supports and services. The direct workforce is holding up some of those. We're having some trouble staffing positions. It's taking a little bit longer than it was. So the dashboard should provide the information that you're looking for, and happy to answer any questions about it. But those are the 2 key issues right now. Housing and workforce are issues for us.
Do you know how many people you right now have on the housing wait list? Do you have any idea?
I can look that up while we're meeting if you'd like. I can tell you exactly how many people are looking for housing, and I'll get back to you in a couple minutes.
Okay. And are there any other wait lists besides housing under the Money Follows the Person program?
And just to be clear, it's not actually a wait list. It's just that we're having trouble finding housing. Now, sometimes it's a wait list in the sense that if someone wants to move to specific senior housing, which we do that, we honor the preferences of the individual. Sometimes there's a wait list, not unusual, for certain senior housing or for certain subsidized housing. That's different than if the member gets a voucher. Sometimes they don't want a voucher. Sometimes they actually want to go to where their friends are, and that's not unusual.
Mm-hmm.
And so if that's the case, and that particular housing complex doesn't have any openings, then somebody does go on the wait list. We have had, that's not actually new for us. The turnover is slower, but it's not new for us to honor the preference of the person to say, look, I want to go, but I want to go where my friend is, and tell me when that opening comes up. And then we monitor that and we let them know, and we move, because they're otherwise entitled to be in a nursing home. They're at nursing home level of care. So they have a choice, but sometimes that happens, Representative.
Thank you for that. And just quickly, yes or no, are there other wait lists under Money Follows the Person, whether they be housing, medications, any, just yes or no, are there other wait lists?
I do not believe so, no. I do not believe so, no.
Okay, thank you. Thank you, ma'am.
Thank you very much. Representative Abercrombie.
Thank you, Madam Chair. Good morning, everyone. Thank you, Commissioner. Dawn, just to follow up on that, I think what Representative Walker is getting to is it might not necessarily be that there's a wait list, but you have to admit that there are participants under MFP that are not able to go home because we do not have the workforce to support them. A lot of individuals that go on MFP come from nursing homes that need 24-hour care. And being that there's a shortage, just so we're clear, there are individuals that are not able to go home at this point, correct?
That's correct.
Thank you. I just, for clarification, because I think that sometimes people misinterpret what we mean when we say a wait list.
That's correct. And we do study length of transition. So we'll be able to, we know whether or not it's getting longer. So we'll be able to get that data if you want it. We study for every single member, what's the length of transition.
Yeah, we hear it from the community. We hear it from families all the time, especially of young people, you know, young families who something happens to one of the spouses and they're stuck in a nursing home because they need 24-hour care. So it's not unusual for there to be people that are not able to go home right away because of that. For the mental health waiver, Commissioner, you have 579. That's the full amount that we are allowed under CMS when we applied for this waiver, correct?
I wasn't here when we initially approved the waiver, so I don't know if, Aaron, do you know the origin of that number?
Yes, the number that we can, our limit is 615. So we are not, we have not reached that yet. So, so we have room on the community side to fill those slots.
And is, Deputy Commissioners, the reason why we're not at full capacity, again, a workforce issue?
The reason why we're not at capacity is we have people in various stages of enrollment. So we have people on look back, we have people that are in the process of assessment, and we have people coming on and off. So we also, so that's one of the reasons. We're not affected as much by the workforce issue. We can enroll people. What we have found is that we might not necessarily be able to find their waiver services as quickly, or we might not be able to give them quite as many hours. And so we work around that to be able to enroll people and get people on service and work around. So we have had some issues with workforce, but that has not caused us to typically delay enrolling people on the community side.
Thank you. Thank you very much for that. And then my final question is, thank you for including the interpreter services. The definition of monolingual, that's the first time I've heard that. Who gets served under those interpreter services? What does that mean?
So anybody that speaks one language that isn't English would be, so it could be deaf and hard of hearing. So we get interpreters for ASL. We've gotten Polish interpreters, Spanish interpreters, Portuguese. So whatever language they feel comfortable being assessed. And we want people assessed in the language that they feel most comfortable, because then we're going to get the better information and more accurate information. So if people ask or request, we will provide interpreting services in any language that is available and that the client requests.
So this doesn't limit us at all, does it? Versus being a multilingual interpreter.
No.
So is this related to the person or the person that's going to be offering the services?
It's related to the person we're offering, so that mental health waiver participant. So we offer those interpreting services to the participant to be able to assess and then enroll them. And when we enroll them, then we will also provide interpreting services to give them, to provide the services necessary in the home. So it's both.
Okay. Thank you. Thank you, Madam Chair.
Thank you very much, Representative Abercrombie. Representative Johnson, followed by Representative Hughes.
Thank you so much, Madam Chair. Thank you for your presentation today. I just have some of the questions I was going to ask were actually brought up by Representative Walker and Representative Abercrombie. Just to follow up a little bit on the idea of which institutions we're talking about when we're talking about discharge with money follows the person. I just, I'm concerned about what's going on with hospitals and discharge planning and whether or not there's adequate healthcare services. And when we look at the hospitals and discharge planning, there's two issues that we, that seem to be problematic, and at least from what I've heard from constituents. And that is, first of all, there is people who may be staying in hospitals under observation status, so they're not actually, they have not actually been admitted to the hospital. Nevertheless, they've actually been in a situation where they are receiving hospital services, say for the full 3 days or for longer than overnight. And then, so following up on that, do we have data that addresses money follows the person for something like that? Or is it with respect to just skilled nursing facilities? Or is it just with respect to, say, discharge planning and not having adequate home care services to be able to find a place for somebody who maybe say a discharge plan for someone who's in a skilled nursing facility, goes to the hospital, and then maybe could have a situation where they would have a money follows the person situation.
Yeah. So thank you for that question. The Money Follows the Person is a program specifically designed to transition people from long-term care institutions to home and community-based services. It does not address the transitions of care from acute care hospitals like you're describing into the community. Those, there are other issues and programs and payment issues related to that. But MFP was part of the federal effort to rebalance the long-term care system, move people out of institutions and into community settings. So it's very specifically tailored at people who are primarily in skilled nursing facilities, but a few other types of long-term care institutions as well that could qualify.
Great. Thank you so much. And thank you, Madam Chair.
Thank you, Madam Chair, and thank you, Commissioner. I just clarify for my colleagues in the public, the MFP waiver is strictly for adults, right? This is not about children on Husky in long-term care.
Go ahead, Dawn.
It includes people of all ages as long as they're in a qualified institution. It includes children.
Oh, it does include children. Do we know how many are?
Can I clarify for the mental health waiver?
Yeah.
You have to be 22 years and older.
That's what I thought.
Yes.
Okay, great. And also, you might have covered this and I missed it, case management. Is that part of the mental health waiver is case management services?
Yes, we have community support program or CSP, and that is case management, and that is already part of the waiver.
Great. That's my only questions. Thank you.
Thank you very much, Representative Hughes. Representative Nolan.
Excuse me. Good morning, and thank you for the information that you're providing us so that we can move this across. I just had a couple questions, and first question is in regards to something that Rep. Hughes just mentioned is the aspect of the children. Are there requirements covered under? I mean, I know it was 21 and older for, but what is their requirements covered under versus the adults?
Excuse me. Representative Nolan, I'm not totally clear what you're asking. Are you asking if we have these mental health services also available for children?
Yeah, like is it covered under the same heading as the adults, or is it a different name?
Well, I imagine the answer to that question is both. Maybe Aaron, you can help me out. I think some of the same types of services that are provided under this adult mental health waiver are also provided to children through various means, but the programs may go by different names. And the providers are likely different providers, but in general, I would say that under the Medicaid program, we typically are required to provide all medically necessary services to children. That's a Medicaid and CHIP requirement. So to the extent that they're available in the community, those services would be covered for children. I'm sorry, I'm not being more specific, but if you have a specific question, maybe we can try to get the answer for you.
No, that's a little bit of what I was wondering as far as the Medicaid program and the CHIP require it, but I just wondered if it was how different it was for the youth, for children, in regards to like waiting lists and getting services than it is with adults.
That I wouldn't be able to give you a sort of a comprehensive answer to at this moment. Aaron, do you have any sense of that or comments that might be helpful?
Well, DMIS serves people 18 years and older, so I don't have any information for you for children younger than 18. We do have a young adult service program for DMIS, which works very closely with DCF in transitioning people, but I wouldn't be able to answer on the children's side as we're an agency that serves adults. And and Medicaid questions, certainly could be answered by DSS.
Representative Nolan, we'd be happy to follow up with you if you have, specific services or populations that you have questions about. Please feel free to reach out to us and we'll work with DCF and make sure you get an answer to your concerns.
Okay, thank you. And as far as the direct workforce obstacle, I guess, what are we doing to try and correct that? How are we seeking people to fill those positions?
Well, that's a very important question. As you know, the entire healthcare industry is facing workforce challenges right now. Everything from physicians through nurses to ancillary staff to home care services. So this is part and parcel of a very significant challenge that the healthcare system is grappling with. We have been working on the mental health front. We have been working closely with DEMIS and DCF and the Office of Workforce Strategy to try to define which professions in particular are facing the most severe shortages and looking at educational strategies, licensure and certification strategies, potential for loan repayment or scholarship strategies. And then, of course, there have been financial supports offered throughout the pandemic to try to help the industry cope with some of the costs that they've been facing. So we've been taking a multi-pronged approach, everything from the pipeline to the training to the payment to try to support wherever we can. Dawn, do you have anything, or Aaron, anything else to add about specific efforts being made?
We have a fiscal intermediary, Advanced Behavioral Health, and they are continuously working with agencies and looking for agencies and staffing. So that is a continuous element that we're working on, and especially now with the shortage. So that is something that we're focused on, helping agencies, and we are out there trying to find staff and agencies to provide the services.
We also, sir, we did receive an additional $5 million under as a money follows the person's state. And we are dedicating some of that money to try to increase the number of workers, attract workers to the direct workforce, build a ladder, do the things that we can. So we're working on it. We're aware of it and we're working on it. It's a tough one though, as the commissioner said.
Right. Well, thank you for your answers. And I'll, like Commissioner said, I'll reach out to her on specifics in regards to services for youth. Thank you very much and happy holidays.
And I would just caution people when they're reaching out individually for questions they have for the group, that we get the answers in totality to everybody, not just to one person, because that doesn't resolve our issue. So Representative Nolan, are you all set?
Yes, thank you, Madam Chair.
Representative Santiago.
Good morning. Thank you, Madam Chair. I just have two quick questions. Can you hear me?
Yes, we can.
Yes. Okay. So though, I don't know if this was answered in the beginning, how many folks are outplaced from the state to another state? And the second question, is there a specific policy within either DSS or DEMIS or one of the state departments that is a limit on outplaced folks in another state, limiting their time to visit family in the state of Connecticut?
Commissioner?
Good morning, Representative. So in general, in Husky, we do everything we can to provide services within the state of Connecticut. That's always our first effort, and our teams work really hard to achieve that. However, for some usually very complex or difficult to place individuals, We do rely on services out of state. Most often that's in one of our border states, but sometimes, we have people who receive services fairly far away. That's rare. We don't have a cap per se on how many people can receive services out of state. It's, across all of our membership, we have, close to 1 million people in Husky. I'm sure we have a fair number that are receiving some variety of service out of state. But in general, as I was saying, we do our utmost to place people in services within the state of Connecticut. With respect to visitation, I can't speak to what other states, during COVID, what's been happening with visitation, but we don't have any particular DSS policy with respect to that.
Okay, great, because I do have a case, and I'll reach out to your office that there's a family that is in, the adult is placed in Massachusetts, and then now she was told that he only has 18 days of visitation for the year to come back to Connecticut, and she's worried that the limit will be more than 18 days, and she's not going to be able to see her son. But I'll reach out to you with this particular case. Thank you.
Thank you very much, Representative Santiago. Representative Aurora.
Thank you, Madam Chair, and thank you, Madam Commissioner. It's so good to see everyone in the committee on the Zoom. I have a couple of clarification questions, and perhaps they have been mentioned during the discussion, so please pardon me if they have. The way I'm reading the document here is that the number of spots is being expanded from 579 to 752 and going up. Is that the way, am I reading it right?
Yes.
Thank you, and that's what I thought. And the second is just to kind of see what we're talking about. So 27,000 is the waiver services of the 52,000 overall service cost. So we're talking about, call it 800 times 27,000. So 20 million is the scope of this waiver program. Just to look at the order of magnitude, so as to say, am I again thinking about it right when I'm thinking about the program, what we are voting on?
Yes.
Excellent. That's great. And finally, on the assistive technology, is it going to be available to all the 800 participants, or that's a judgment the DSS or the agency will make based on whether it's useful for them or not? And that, as I understand, is totally new. So is that included in the cost which is being discussed, or is it an additional cost?
It would be included in the total cost that we've discussed because they're Medicaid related costs. For this waiver and for all waivers, Representative, it's required that an individual have what's called a plan of care. And that sort of lays out what the services, what the needs are of the individual based on a structured assessment, and then what the services are that will be provided under the waiver to meet those needs. So if an individual has the need for assistive technology in their plan of care, it would be a covered benefit.
Got it. Well, thank you so much for the clarification. I really appreciate it, Madam Commissioner, and happy holidays and Merry Christmas to everyone.
Likewise, thank you.
Thank you, Representative Aurora. Representative Walker.
Thank you, Madam Chair, for the second time. I just have a question. If I qualify for Money Follows a Person on basically when I apply for Money Follows a Person, I'm sorry, my dog. If I apply for Money Follows a Person, I am qualified for any of the programs under Money Follows a Person. Is that correct?
Well, if you qualify for Money Follows the Person, you can receive the services that you need to transition from the institution to the community. And you receive those for 365 days under MFP. And then at the conclusion of that year, those services would be provided under another home and community-based services program based on the needs of the particular individual. Does that answer your question?
Yes, thank you. Thank you, ma'am. Thank you, Madam.
Thank you. Excuse me, Representative McCarty.
Yes, thank you very much, Madam Chair. And just very quickly to the Commissioner, in reading through, and I believe these waiver applications are done very thoroughly and look like some good changes, but I noticed there's a waiver advisory council. Can you just address that for a moment? I was unaware of the advisory council in the past, just wonder what their role is and if they work with you and if there's someone on the home and community-based providers, if they happen to serve on that council. Thank you.
Would you like me to answer that, Commissioner Gifford? So we have an advisory council that meets twice a year. It is part of our application. It's a requirement, a CMS requirement. We chair that. We do have people from DSS that are on that committee. We have waiver participants, so people with lived experience that are on the committee. We have Connecticut Legal Rights Project. We have providers, multiple providers that are on the committee as well. So it's really open. We're always looking for people to join us, and they help inform us. So we will often ask for input. We'll ask for their opinions on moving forward. So for instance, we had a discussion with them about changes that we were proposing, the in-home counseling and the interpreter. And so they were able to help us and give us their opinion on what changes. So they really help us with looking at programming moving forward.
And thank you very much for that answer. It really helps. Thank you.
Thank you very much, Representative McCarty. Are there any other questions? Just make a round robin. Representative Walker, anything else? She must be yelling at her dog. Representative Abercrombie? No? Senator Moore, anything else? Representative France?
I'm all set. Thank you, Madam Chair.
Senator Minor? Representative Case? Senator Berthal? I see no other questions. Madam Administrator?
We're ready for you to adjourn the hearing, Madam Chair.
I am adjourning the hearing. And is there anything else? Are we going to take a vote?
Yes, Madam Chair, the Human Services Committee will vote first.
Okay. Representative Abercrombie, is that you?
Yes, Madam Chair, thank you. I will entertain a motion to approve the 1950C Home and Community-Based Services Mental Health Medicaid Waiver Renewal.
Rep. Hughes, so moved.
Second by Representative Dathan.
Representative
One moment, please, sorry. It was moved by Representative Hughes, second by Representative Dathan. Questions or comments? Representative Case?
Yeah, I just heard the word that came across the screen that recording has stopped. Didn't know if that happened.
Madam Admin?
Yes, go ahead, Madam Administrator.
Thank you, Heather. Representative Case, we stopped the recording because the recording is for transcript purposes. We are still being broadcast live on YouTube.
Okay, I didn't know if votes were recorded, that's all.
So they are on YouTube live.
Thank you.
You're welcome.
Any further questions or comments about the renewal of the mental health waiver? Seeing none. Heather, will you call the roll, please?
Thank you, Madam Chair. Representative Abercrombie.
Yes.
And just as a reminder, because we're out of practice, for each legislator, if you could please state your name and then your vote. That way it'll ensure that the Zoom picks you up so everybody can see you.
Representative Abercrombie. Yes.
Thank you, Representative. Senator Moore.
Senator Moore, yes.
Thank you, Senator. Senator Berthel. Representative Case.
Representative Case, yes.
Thank you, Representative. Senator Lesser. Representative Garibay. Representative Garibay.
Representative Garibay, yes.
Thank you, Representative. Senator Cabrera.
Senator Cabrera votes yes.
Thank you, Senator. Representative Butler. Representative Cook.
Representative Cook votes yes.
Thank you, Representative. Representative Dathan.
Representative Dathan votes yes.
Thank you, Representative. Representative Goupil.
Representative Goupil votes yes.
Thank you, Representative. Representative Hughes.
Representative Hughes votes yes.
Thank you, Representative. Representative Santiago.
Representative Santiago votes yes.
Thank you, Representative. Representative Stallworth. Representative Aurora.
Rep. Aurora votes yes.
Thank you, Representative. Representative Buckby. Representative Master Francesco. Representative Scott.
Representative Scott votes yes.
Thank you, Representative. Representative Wood. Are there any other members of the Human Services Committee who have not voted who would like to do so at this time? All right, Representative Abercrombie, just give me a moment and I will prepare the tally. I'm ready when you are, Representative Abercrombie.
Please announce the tally.
Thank you. Total number voting, 12. Total number voting yay, 12. Total voting nay, 0. Total abstentions, 0. Total absent not voting, 7.
The mental health waiver renewal is approved. I will now recess Human Services and turn it back over to Senator Austin.
Thank you very much, Representative Abercrombie. I'll entertain a motion to approve the mental health waiver renewal. I did not catch who.
Representative Walker moved.
Representative Nolan second.
Thank you. Is there any discussion? Seeing none, Madam Administrator?
Senator Austin.
Senator Austin votes in the affirmative.
Representative Walker. Representative Walker votes in the affirmative. Senator Hartley. Representative Dathan.
Representative Dathan votes yes.
Representative Nolan.
Nolan in the affirmative.
Senator Minor. Representative France.
Representative France votes yes.
Representative Abercrombie.
Representative Abercrombie votes yes.
Senator Doherty Abrams.
Senator Doherty Abrams votes yes.
Senator Anwar. Representative Baker,
Representative Baker votes yes.
Representative Betts, Representative Belinsky,
Representative Belinsky votes yay.
Representative Candelaria, Senator Ciccarella, Representative Curry,
Representative Curry votes yes.
Representative Dillon,
Representative Dillon votes yes.
Representative Felipe, Representative Ferraro, Senator Flexer,
Senator Flexer votes yes.
one more time for me, please, so I can see you.
I'm gonna have to pass.
Okay. Representative Gibson,
Representative Gibson votes yes.
Representative Gilchrist,
Representative Gilchrist votes yes.
Representative Gonzalez, Representative Haddad, Representative Carol Hall, Representative Joshua Hall, Representative Harrison,
Representative Harrison votes yes.
Representative Hayes, Representative Howard,
Representative Howard votes yes.
Representative Johnson,
Representative Johnson votes yes.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes yes.
Senator Lesser, Senator Lopes,
Senator Lopes votes yes.
Representative McCarty,
Representative McCarty votes yes.
Senator McCrory,
Senator McCrory votes yes.
Representative McGee, Representative Pavlak D'Amato,
Pavlak D'Amato votes yes.
Representative Porter,
Representative Porter votes in the affirmative.
I'm sorry, ma'am, I cannot take your vote because I don't have your video. I can't take it just by audio.
I'm on. Does anybody else see me?
No, I don't see you.
Yeah, I'm signed in. I see everybody.
Madam Administrator, she might have her voice.
Representative Porter votes in the affirmative.
Yay, I saw you. We're good.
Thank you.
Thank you. Representative Reyes. Representative Rosario.
Representative Rosario in the affirmative.
Representative Ryan.
Representative Ryan votes yes.
Representative Sanchez. Representative Sims. Senator Summers. Representative Tersiak.
Representative Tersiak votes yes. Thank you.
Representative Turco.
Representative Turco votes yes.
Representative Wilson. Senator Winfield.
Senator Winfield in the affirmative.
Representative Zalestowski.
Representative Zalestowski votes yes.
I see Representative Haddad.
Representative Haddad votes yes.
Are there any other members of the Appropriations Committee? I see Representative Felipe.
Representative Felipe votes in the affirmative.
Thank you.
Thank you.
Any other members of the Appropriations Committee who have not yet voted who would like to do so at this time?
Sue, can I just check? Did you get my vote, Representative Ryan?
Yes, sir, I did.
Okay, thank you.
You're welcome.
Madam Administrator, can you give us the tally?
Before I announce the tally, Madam Chair, I'd just like to announce that Representative Ferraro has been having technical issues all morning long, so he was unable to cast his vote because of those technological issues. Total number voting is 31. Those voting yay, 31. Those voting nay, 0. Those abstaining, 0. Those absent, not voting, 19.
Thank you very much, Madam Administrator. The waiver renewal is approved. And the Appropriations Committee, I'll entertain a motion to adjourn the Appropriations Committee.
Moved by Abercrombie.
Moved by Abercrombie, seconded by Representative Porter. All those in favor indicate by saying aye.
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 Any opposed? Any abstentions? The Appropriations meeting is adjourned. Representative Abercrombie.
Thank you, Madam Chair. I'll entertain a motion to adjourn the Human Services Committee meeting. Human Services members, JK, Senator Moore.
So moved. Motion.
So moved. Representative.
It's been moved by Representative Garibay and seconded by Representative Cook. The Human Services Committee is adjourned. Thank you, Madam Chair.
Thank you. Madam Administrator, can you let people know what our next couple of meetings are?
Yes, we are going to be scheduling our next informational forum, this one on the adult behavioral health system. And that will be in January, on January, oh, excuse me, Madam Chair. Hold on, I feel a sneeze, sorry.
I know it starts to get dusty.
Yep, I'm sorry, and it's passed. So the Adult Behavioral Health System Forum will be on January 11th, and then we are anticipating receiving state plan amendment from the Department of Social Services later this month, and we will be scheduling that hearing and committee meeting jointly with the Human Services Committee, hopefully for January 13th.
Thank you very much, Madam Administrator. I would also like to take a moment of silence for Senator Craig, who passed away last week. If people wouldn't mind giving me a little bit of a moment to all that she did for the state of Connecticut. Thank you all so much. I appreciate that. And Representative Walker, do you have any closing words?
No, but I'm so glad that you gave honor to Senator Craig. If you've been on Human Services or Appropriations, you know the giant that she was and how hard she worked for all the people of Connecticut, all ages. And it is very sad to have her lost, but she definitely has left a mark in Connecticut. And I thank you for that moment. Thank you, ma'am.
Representative France. Senator Minor. And for those of you, Senator Minor had some constituent business today, and he was going to be in and out of the ability to connect. Representative Abercrombie.
I just want to echo that Senator Craig was quite a force to be reckoned with. And I personally learned so much from her. And I think that the state is a better place because of her dedication, especially to the senior population. So to everyone on this call, Merry Christmas. And I wish you much health and happiness in 2022. And please stay safe, everyone. Thank you, Madam Chair.
Senator Moore.
Thank you for taking that moment for Senator Prague. I had the honor of working with her as Senator Gomes's aide. And I was hoping we could have a moment of silence from this buzzsaw, but I just want to say have a happy holiday, be safe, and love your children. Thank you all.
Thank you. Representative Case. Senator Berthel. Thank you all. Senator Kushner, you have your hand up.
Yes, thank you, Senator Austin, Madam Chair. I just wanted to say, as the current labor chair for the Senate, I never served with Senator Craig, but of course, as one of the labor leaders in Connecticut, I had many opportunities to work with her, and there was never a more fervent supporter of working families in Connecticut. She was a loud and distinct voice for all that is good in Connecticut, and her voice stays in my head, like I'm sure it's in all of your heads, because it was so wonderful. And so I appreciate the moment of silence and the opportunity to say a few words in memoriam, because she was a true fighter for justice and we loved her.
Thank you very much. Thank you all. I hope you all have nice holidays, whatever holiday you choose to be that is relevant to you. And we look forward to getting together over the next few weeks. Talk to you all soon. Bye.
Merry
Bye.
Christmas, everyone.
Merry Christmas.
Merry Christmas, everybody. Merry Christmas.